would like to talk to you today about how this crisis is actually an opportunity for us. I know many of you have heard about it before, about the technologies and the corporations, but I'm talking about also the patient side, which is a bit neglected at the moment. And when you talk to patient advocates nowadays, they're much complaining about how day-to-day healthcare and patient service is being pushed to the side. So I want to talk about it a bit today, and let me share some slides with you if you don't mind. Just a second. Great. Okay. So I want to talk about our opportunities and what's happening a bit in Israel. Maybe you heard about it from our amazing other Israeli speakers, but we have a few amazing, innovative adaptation that's going on today, and I want to talk about it. First of all, I want to tell you a bit about my own story. I'm 37 years old, as I mentioned, and when I was a soldier in the Israel Defense Forces, when I was around 19, I sustained an injury that made me kind of disabled for a few months, but everything was supposed to be okay, and it wasn't eventually, and my body started to deteriorate. And after a bit longer in the army, I couldn't even serve anymore, so I was honorably discharged from the army, and the doctors made a few attempts with me. So what happened was very interesting, that today we know that a gluten-free diet can help a lot of autoimmune illnesses. Back then they thought maybe I have celiac disease, and again this diet was tried, and I felt a bit better, so the doctor thought, okay, it must be celiac disease, you're on your way to become better. So what I did is to kind of go on with my life. I was 20 years old, I wanted to be a doctor, so I enrolled into medical school, and little did I know that the story is not ended. I was a volunteer in the Israeli Red Cross in Magen David Adom, and on my last shift before starting medical school in Italy, I collapsed and I was rushed into hospitals, and there was a series of terrible mistakes and misconducts regarding how patients should be treated, and I almost lost my life a few times because of those mistakes. The worst of them was a misdiagnosis of basically a heart attack. The doctor thought I'm having a heart attack, and I was like 21 years old. And they were about to give me a medication that if I wasn't a medic in the Red Cross, I would probably not say anything and be dead today. But I knew that my blood pressure is too low to get this medication. I had to hold the doctor's hand and actually physically stopped it. And it was the first time in my life that I kind of thought that maybe healthcare is not as perfect as I thought, because we have a very good healthcare system in Israel, and maybe doctors can also make mistakes. They're also humans. But it wasn't the end. I got admitted to the hospital for a few weeks, and the doctor thought I'm going to be okay in a month or two, but eventually I was too sick to go to medical school. And the week got by, I got sicker and sicker and sicker, and eventually, after a few months, I lost my ability to walk, and later on, I couldn't talk anymore, and I was completely bedridden and completely disabled, and I spent the last few years actually trying to find a solution to my condition, to find a diagnosis, and I've seen more than enough doctors. I've seen 33 doctors actually, and they couldn't find anything. And the last doctor, which I was waiting so long for, actually, it just took a few minutes, maybe 2 or 3 minutes, just to go over my medical records. In the 24th century, we still go on with this kind of paper book of a record, but he had to go flip through it. And he basically shut the book down and told my dad, my parents were with me, he didn't even look at me or at my mom, he just looked at my dad and told him, I don't know what it is, but I've seen enough cases in my 30 years of doctors to know that sometimes it's probably this rare genetic syndrome, and all I can say is that your child is basically gone. this kid is never going to work a day in his life, never going to marry a woman, and never going to go to university. Those three no's kind of vibrated in my head, and my parents were shocked. And this doctor continued and said that maybe if I want to have some sort of freedom, I can get a wheelchair and spin around home. And he suggested my parents basically to buy me a nice mattress, connect me to a cable service, and grow old with dignity. I came back home very, very sad that day because I was almost 25. I spent a few years in bed with no hope, basically. And in that day, I've decided that basically I have only two choices in my life. I can heal myself or I can kill myself. And I thought all night long if it's actually worth it to live or commit suicide. But eventually I chose life, and I dedicated the next 2 years to obtain all the curricula materials of the Tel Aviv University Medical School. And I spent 2 years studying everything from cell biology to pathophysiology and lab results interpretation and imaging interpretation. And I basically found my own diagnosis. It took 6 more months, but doctors in the Tel Aviv Medical Center confirmed my diagnosis. And I had to go through a long way of rehabilitation. I became from a patient that nobody even cares about or blamed that he's inventing his own illness to a patient who is too sick to be treated. No rehabilitation center in Israel would agree to treat me because they were too afraid. So I had to design my own rehabilitation program. It took me another year, but I became from a bedridden. I couldn't walk. I was in a wheelchair. And I taught myself to walk. I taught myself to talk. I couldn't speak for more than 5 to 10 seconds. I couldn't stand. I couldn't move my head because I would faint all the time. This illness is very severe. It was featured in an episode of House and recently in Netflix in an episode of Diagnosis, which is a wonderful series. It's called POTS syndrome, and it's a part of a larger family of illnesses called dysautonomia or dysfunction in the autonomic nervous system. My story led me to realize that we have a broken healthcare, as we all know, but seeing both sides of healthcare, first as a clinician, as a paramedic, and then as a patient, got me to realize that the patients are actually poorly mistreated and we should do something about it. So ever since, I've devoted my life for projects that aim to fix the miscommunication between doctors and patients and to fix healthcare in digital health, in medical devices, in policy making, in health education and promotion. So that's what I'm doing in the last 10 years, ever since I learned to walk again. And I want to talk to you today about my perspective of looking at COVID as an amazing opportunity to fix healthcare, and specifically from our side as patients. So everybody's talking about remote health, and it's such a big deal right now. And even my own company, Valero Clinical, we're supplying a tool for doctors to do HIPAA-certified remote visits. And it's such a great hype, but we mustn't forget the human aspects of it. On the one hand, of course, it's the future, and many of the physical appointments we have with doctors today may be redundant in the future, but we must look also at the human side and how can we actually transform the kind of cold digital visit to something more humane. We see it a lot also in conferences like we have today, that we're trying to kind of mimic this beautiful interaction that we have and the stage that the speakers are giving. And this is a challenge for all digital aspects, not only for healthcare, to kind of bring humanity in here. But I want to also feature a few things really cool that is happening in Israel. A few examples, most of you may know them. I'm just going to go briefly through them to show that we are at a point that maybe we're kind of old-fashioned thinking about how to admit patients and how to treat them on site. And maybe we should start to think about more health monitoring than actually admission in hospitals. I hope that everybody knows this amazing company founded by Yonatan Adiri, who was the CTO of the presidents of Israel, Shimon Peres. Healthy.io is a really cool company, and what they did is basically they're digitizing and mobilizing the urine testing that we all know. you know that if you do a urine test, you have to go to a lab and you pee in a cup and put the stick on. And if it's not you putting the stick on, so it's the nurse or the lab technician. And basically, you've spent a lot of time and money and efforts. And basically what they did, it's the first FDA approved digital diagnostic tool that is one-to-one as diagnostic accurate as the actual urine sample, and the possibilities are infinite. So we start to make a picture here that actually will kind of build this notion of not only mobile applications, but also an entire ecosystem around the patients. Okay, so this is one example, and we're talking about patients doing it from home or at work. It doesn't have to be on site anymore. And something amazing that is happening now in Israel's Sheba Medical Center. Sheba Medical Center is the largest hospital in Israel, resides in the outskirts of Tel Aviv. And we have the largest corona intensive care unit. And basically what's happening is that in this unit, instead of using regular monitor that basically capture in very general the heart rate, the blood pressure, and the oxygen level in the blood, some other parameters, but basically those devices are big, it's size of like a video recorder, and they're very expensive. And they have started to use this FDA and CE approved Israeli device called Biobit. There are two versions. One of them is more for consumer use, more like a smartwatch that help monitor health. You have a lot of parameters like body temperature and participation, like sweat levels, and maybe in the future even sugar levels, blood pressure, heart rate, blood oxygen levels. And it's actually replacing the actual monitoring devices in the intensive care unit. It's now being used for not the most severe patients that are intubated, the less severe patient that can be monitored less intensively, but it's a revolution happening in front of our eyes at the moment that actually we're minimizing technologies and we can take it with us. So if we think about home care and we think about monitoring of patient and admitting patient, maybe we should rethink everything that is also the experience we have as patients, because many of the time I've been to hospitals, I've been admitted to hospital, and basically 90 or 95% of the time I'm just laying in my bed, you know, reading a book or doing something else, but nothing medically is happening with me. They come in the morning, they take your blood, and you have a test or two during these few days of admission, but nothing is dramatically happening there. And I stress that if it's not intensively intensive care demanding, maybe we should kind of start to bring patient more as a primary care approach and not secondary care approach. I think that the future is in front of us, but for me as a patient, to look at this invention and say, maybe I can just spend less days in hospital, it's already making me feel better. And I think it's something we should all consider. When you ask me, what's going to be the next thing regarding taking healthcare out of the hospitals? And again, from my patient approach, I would say that wearables are the future. The Biobit has a wearable that is completely approved already, but we have more consumer-based famous ones that we all know, like the Apple Watch, and recently in the last 2 years they've added the ECG. It's only one lead, but eventually we're going to see more and more features. And when you treat chronic illness patients, you should take into account the fact that the well-being is super important, and the well-being is very affected by the environment. And if I can be monitored and share with my physician certain aspects, I would be much happier than to actually come to the hospital, you know, wait a few months to see my doctor. I have a lot of questions to ask him. So the gap for me is the few months between doctor's visit when you have chronic illness. And in my illness, which is a lot to do with the tachycardia and arrhythmia and pulse, I would like that if I feel bad, my doctor can actually be exposed to this data immediately. And if I have an Apple Watch and I allow the medical center to access my data, so in this perfect world, I actually come to see my doctor only when actually necessary, and I'm more engaged in wellness and rehabilitation than actual have to go to the hospital. When I did my rehabilitation for the second time, I had a relapse. I had to be in a hospital almost every day for 6 months. And basically what I did is basically what I can do in the gym by myself. At the beginning, you can faint. So of course you need some monitoring, but later on, like I had to go there just to be connected to kind of this strip that measure the same thing that the Apple Watch can do. So maybe we can design a more digital tool to help doctors rehabilitate patients at home or at more community care facilities. As a patient, it's such a great hassle to drive every day to a major medical center and to actually go through this bureaucracy and procedures all over again. And we will better be off monitored. And again, we have privacy issues, but I don't mind my medical center be exposed to my vitals if I know that I'm being monitored, and algorithms are helping doctors with decision support tools to figure out when do I need intervention and when I don't. We talk a lot about patient-centered care, and now in Corona it's funny because basically care has been seized almost everywhere. And you have a lot of problems that I'm starting to hear from family practices, family physicians, primary care experts talking about the fact that people are afraid to go see their doctor. And we have a lot of more severe cases that people actually missed a heart attack or a stroke or so on. We have an opportunity right now because we must engage in more digital tools. We have an opportunity to actually make patient care really centered because we can prioritize. We realize that this pandemic is one of maybe many that may come, or other natural disaster that may come. And I think that this period of crisis can be the kind of cold cut that we need to actually put healthcare around the patient. I know they talk a lot about it in many, many aspects in journals and conferences, but for the most part, I see it only as an empty phrase. Medical centers used to be more accessible to their patients in terms of marketing. But when I talk about patient-centered care, I'm talking about actually putting everything around the patient. Because in my idea, healthcare is the only industry in the world in which the customer's view doesn't matter. Imagine you have a drink, like a soft drink company, and your drinks are not very tasty. So after a week or two, you cease production because nobody will buy your drinks. But in healthcare, you give very poor care in a lot of places in the world. A lot of developed countries still provide poor care. Even if the medical standards are high, the service standards in most parts are very low because we're dealing with burdened and overburdened and overstressed staff that eventually it seeps through to the patient. And if we want to do it now, we have an amazing opportunity to actually put the patient in the center and kind of prioritize what can we do digitally and remotely, and where does the doctor intervene? When do I need to see my doctor? If I need a note for work, do I need to see my doctor physically and capture this precious time slot for other persons? Or if I'm a chronic illness patient and I have complaints every day, if the doctor is the right address, maybe we can digitally solve this miscommunication pandemic that we see, that eventually many patients are feeling that they're left alone and that the care is not around them. I think we have an opportunity here to actually reshape healthcare digitally and physically, and with the right prioritization to create healthcare that is actually really caring for the patients. It leads me to an amazing question. I'm sorry. An amazing question that has been risen in one of my projects. Excuse me. I served as the first ever patient in residence, or chief patient, as far as we know, in the EU, as a senior member of a medical organization that makes decisions just like the doctors and the professors and the head nurses in the organization. And while serving in this amazing institute in Austria called the Ludwig Boltzmann Institute, we basically try to create a lot of policies to involve and engage patients, specifically in areas of medical research, but it's also applying for actual healthcare on primary and secondary levels. And it's amazing to see that there is a debate going on that is eventually what's going to happen in 10 or 20 years, like who is going to be my doctor? And some doctors are afraid to lose kind of their seniority or space because we're taking a lot of things to digital. But I think that eventually what we're creating is a more just system. Because if we put everything around the patient, and the doctor is basically using a lot of tools, but his amazing knowledge and experience to make the decisions, eventually we are taking the burden of doctors that is now occupying their time in such a way that will not ever allow adequate patient care. In America, we're talking around 60% of each doctor's visit time is going wasted on scribing and logging your problems. This is what my company does in America, Valero Clinical. We are tackling exactly this problem so we can save this process and automate whatever can be automated in the visit. But if you're talking about generally right now, the European Union or the States, I think that eventually in the future, we're going to see doctors more as kind of, supervisor. And of course, they're going to engage with patients, but a lot of things are going to be digitized. And I believe that eventually the actual care will be more given and provided by advanced providers like nurse practitioners and physician assistants. And doctors will engage a lot in monitoring, decision-making, research, and so on, because we see a lot of redundancies happening. And I believe that eventually, if we build a new system post-corona, we can solve a lot of those redundancies. A resident in Israel that works for, it was 32 hours, now it's 26 hours, and hopefully the government will cut it down more. And he's not sleeping, and he can barely even make a proper decision after 26 hours. And then a lot of his time is wasted on drawing bloods from all the patients in the internal ward or conducting minor procedures that other people can do. Why? Because senior doctors did it 20 years ago and now you should do it. But of course it's stupid, of course it's redundant. And eventually, I don't think that we're taking the seniority of doctors or the limelight of doctors if we allocate other responsibilities to other people. We are going to see a sphere that if in the 40s a pilot of a plane had to all do the actual controls and control every button of the planes, today you have the pilot, the captain, more as a supervisor, and you have another supervisor in the tower. So I think that eventually we're going to have a lot of support and decision support system, a lot of automations going on, and the care will going to be conducted more by advanced providers. And I think it's better for the patients. And doctors will be in a more supervision kind of roles. And I think it's not bad, because when we talk about years of training and we talk about expertise, we need to remember that eventually we don't want to waste those precious resources. And eventually, me as a patient, all I care about when I come to a hospital is being treated as a human, is being seen, and of course get an adequate health care. And even if I get a very good procedure done, but somebody treats me really badly, I'm going to have a very bad experience. That's the reason I'm trying to promote the idea of a patient in residence. I believe that any organization that involves patients, and it doesn't matter if it's a research organization actually health organization like hospital or HMO or clinic, or even a medical startup, everybody that has something to do with patients should have a chief patient or a patient in residence to represent the needs of the patient. And I had a unique glimpse to be a lot in hospitals and on the field as a paramedic. And so to see the clinical side, to see the patient side for more than 10 years, and to be a patient leader. I'm a leader of the Israeli Society of Dysautonomia and other groups, and to actually see policies being made. So I think that eventually we're talking about bringing medicine back to be patient-oriented. And I want to thank you all, and if we have enough time to open the stage for questions. Thank you so much.
Thank you, Roy. Thank you so much for this inspiring talk. I think all our entire audience is very happy to have heard your story, Roy. But I'm so sorry, we've run over time. I know people have a bunch of questions. If you click that session icon on the left, you can create your own session. And I think a lot of people might join you, and maybe you can answer some questions actually in person. So it would be like the audience and you like this virtually.
Of course, I will do it now, and I'll share my link to my website if somebody wants to.
Perfect. Thank you so much, Roy, once again. Take care.
Thank you so much. Bye-bye.
Bye-bye.